We're on.
All right. Welcome, everybody. Happy Wednesday. Thanks for attending this Dairy Calf and Heifer Association Calf Chat. I'm Sue Puffenbarger. I'm a territory manager in Virginia for Zoetis, and I have with me our tech service vet on the East Coast, Dr. Geof Smith. He's here today to talk to you about using nutrition to produce healthy calves. Some comments before we got started. If you have any questions, there's a comment box. Please type them in there. We'll be taking questions throughout the presentation, and I've got some spots set aside so that we can talk to them during the presentation instead of waiting till the end. So on the right-hand side or down below, you'll see an area to put comments and questions, and then we will answer as we go along. So in the meantime, Dr. Smith, do you want to get started with your presentation?
Sure. Thanks, Sue. I'm excited to talk to everybody today. As she said, I work for Zoetis. You guys know Zoetis is a company that produces state-of-the-art vaccines and antibiotics and things like that. Well, we're not going to talk about any of that today. I'm going to talk about nutrition and colostrum management. And both of those not in a lot of detail, but most of the calf issues we run into out in the field are probably management related, and nutrition and failure of pasture transfer are two of the really big problems we run into. So what I want to do is just take a minute to kind of review what's new there. What are some key things that you need to be focusing on your dairy related to both colostrum and feeding calves, and particularly how that relates to preventing disease. So certainly, if you're on this webinar, you realize that calves are important. Over my 25-year veterinary career, generally my philosophy has been to try to convince people that calves are not necessarily just an expense. They're really an investment in the future of the dairy. We know that heifer survival rate is a key indicator of farm profitability. When they do studies and look at what things about a dairy determine whether it's profitable or not, typically milk production is number one, somatic cell count is often number two, and surprisingly, heifer survival rate is number three. It's more important even than, for example, pregnancy rate. So putting some thought into raising quality heifers is really important. Nutrition is a piece of the puzzle. We know that the more we feed our calves, the higher our average daily gain is early in life, the more productive those heifers will be once they enter the cow herd. So focusing on really putting some time and effort into the calf program is kind of what I'd like you to take as the overall goal of this presentation. So if we say calf wellness or calf health is where the difference begins on a dairy, I really think day one calf care is where we get started. You know, if you spend half your time on day one calf care, I'm not sure that's too much in terms of the pre-weaning period. A lot of the problems that I see come from dirty maternity area, not having a clean maternity area, or problems with colostrum management. So day one calf care is really important. Some of you work on calf ranches where you get calves that are 2 to 3 days old. You don't have anything to do with day one calf care. What I would tell you is that's still a huge piece of the puzzle. So working with your source farms, if you're a calf ranch, on making sure maternity pen's clean, making sure that they get colostrum, making sure they continue to be on a decent milk program until you get them is really important. So certainly making sure calves are born in a clean maternity barn, making sure we're tagging those calves right away, we're dipping the navel and getting colostrum into them, I think is really, really important. Colostrum management, you know, there are a lot of things in terms of raising a calf that I think are important. Colostrum is important, nutrition is important, avoiding stress is important, vaccination program is important. But if you're having, you know, every time I go to a dairy that's having a lot of calf mortality, we're having a lot of diarrhea, this is probably the place where I start the most. This is where I see a lot of problems arising from. You know, colostrum management is not particularly a new or sexy topic. We've been talking about this for 50 years, but we still have problems out there with colostrum management. When we go and do blood total proteins and we check on a lot of dairies, it's still not uncommon that 25 or 30% or sometimes more of those calves are failure of passive transfer. So to me, this is where I start as somebody that focuses a lot on calf health, is making sure that all calves get an adequate volume of good quality, clean colostrum as soon as possible after birth. I say within 2 hours. We have smaller dairies where nobody's there at night. That's not always possible, but making sure that happens as quickly as possible is probably the single most important thing we can do to make sure that we're raising healthy calves. So, in terms of best practices for colostrum management, I would like to see colostrum harvested as soon as we can from the cow, and not that cow waiting hours to get through the parlor. On large dairies, I try to encourage them to find some way to harvest colostrum in the maternity barn if possible. Certainly, if you're looking at building a new maternity barn, keep in mind that we probably want to have some facility in there where we can harvest colostrum right after calving. We want to have some way to test colostrum, and usually that's with a Brix refractometer, so we know what's poor quality and what's good quality. Most dairies are always going to have some good quality and bad quality colostrum, and we need to make sure we can identify that. If we don't need the poor quality colostrum, if you have plenty, we can throw that out. If we don't have adequate volume, we can certainly mark that for bull calves and the good quality for heifer calves. Then we need to have a plan for colostrum handling. Sometimes we have good quality colostrum, but we don't get it stored or cooled down quickly. If you're not going to feed it right away, we need to make sure we have rapid cooling, not just throwing a gallon of colostrum in the fridge and assuming it'll cool down eventually. We have a lot of bacterial growth in colostrum after it's been collected from the cow. So we'll talk about that a little more, but make sure we have a plan for rapidly cooling and storing colostrum, or go ahead and freezing it right away. Calves typically we recommend 4 liters of colostrum within a couple hours of birth. If that's not possible, if you're a 200 cow dairy, you go to bed at night. To me, when you get there in the morning, that calf is now your number one priority of the day. Not getting the herd milk, not feeding. The first thing I need to do is get colostrum into that calf, and probably getting colostrum out of the cow that gave birth overnight is also high priority. I would encourage you to have some kind of program in place to monitor colostrum management. So checking total proteins. If you check all calves, that's great. If you're a calf ranch, and most calf ranches will check total proteins on arrival just to make sure things are going well, but at least monthly. Whether you're doing it yourself, you're having your vet when they come out for herd check, take some blood, at least do this every once in a while just to stay ahead of our colostrum management. There's a lot of employees that work on dairies now. Sometimes I have farms that are doing really well with colostrum management. And then we have what I would call employee drift, where, we have somebody different, or we go back to doing it a different way, and suddenly things fall apart. So I like to make sure that we're monitoring total proteins continuously, just to make sure that we're doing well there. And if possible, we need really stable, well-trained maternity barn staff with a plan in place for how are we going to staff that where I live during this time of year, where we're calving really heavy. In the Southeast, typically pregnancy rates go down July, August, September. A lot of cows get pregnant in October, and they're calving now. So, maternity pens are overcrowded. Those maternity barn employees are overworked. So making sure we have people cross-trained that can help during this time of the year is important as well. So strategies for maximizing passive transfer, really there's 3 things that will make your program successful. Getting colostrum out of the cow as quickly as possible. So we know that the antibody concentration in colostrum will start declining pretty quickly after the calf is born. So if we can harvest that, again, 2 to 4 hours would be great. If that's not possible, certainly as soon as possible. So if you wake up in the morning, I want to do it at 6 a.m., not at 10 a.m. when all my other chores are done. Okay. 2, I want to get it into the calf as quickly as possible, whether it was the colostrum from the dam, whether I thawed colostrum out, whether I had colostrum in the fridge that I'm going to warm up, getting some kind of tested colostrum into that calf as quickly as possible. And then lastly, bacterial contamination. So we know bacteria, you can have very good quality colostrum. It can have high antibody concentrations, but bacteria will actually compete with those antibodies for absorption in the gut, in the intestine. So we can have failure of passive transfer if the colostrum is not harvested and fed cleanly. You know, one of the things we'll do sometimes is submit colostrum samples for culture. And typically for colostrum, I want less than 100,000. I'd love it to be less than 50,000 colony forming units per mill. Sometimes colostrum, we don't have great handling and we have bacterial growth. So making sure that I don't have bacterial contamination of colostrum is also really important. Sources of contamination of colostrum, certainly it can be the udder and dirty teats, failing to really prep that cow properly. Usually on most dairies, if we have a colostrum cleanliness problem, it's probably not number one. It's probably either 2 or 3 on this list. Dirty equipment is huge. And particularly, I mentioned earlier, I really like to see the ability to harvest colostrum in the maternity pen. The one problem with that is we often don't have the same sanitation protocols in place for cleaning the equipment that we do in the parlor. So we may have a bucket milker, may have a portable milker, hoses, they don't get changed very regularly. The bucket doesn't get cleaned right. So a lot of times we have dirty equipment associated with harvesting colostrum. We can have dirty tubers, esophageal feeders. We can have dirty hoses with cracks in them. Lots of places where bacteria can hide. And then sometimes improper handling, not getting colostrum cooled quickly, refrigerating it for more than a few days, sitting it out in the sun. You know, you see the picture in the bottom right-hand corner. I can't tell you how many times I've seen a 5-gallon bucket of colostrum in a fridge with a big slime layer of bacteria on top. That's just not the way we want to store colostrum. So colostrum storage is something that I'll take an extra second to talk about here, because you can harvest very clean colostrum. And if you let it set out, remember that bacterial counts are going to double every 20 minutes at temperatures like we have today where I live in North Carolina. So you can have colostrum that starts out, I said you want it less than 50,000 colony forming units or bacteria per mill. Let's say it's 5,000. So it's 10 times less than what I said was your goal. After a few hours of sitting out, it can be way above what we wanted it to be. So you can start with a good quality product. Everybody's done their job collecting it. But if we don't handle it properly, if I don't get it cooled down, I can have really dirty colostrum really quickly. So either getting it fed immediately or frozen or cooled down quickly is really important. And dairy calf and heifer gold standards are that colostrum should be cooled to less than 60 degrees, which is not going to stop bacterial growth, but it will slow it within 30 minutes of collection. Even if you're pasteurizing, you know, realize that that's not sterilization. It's just decreasing bacterial count. So we still need to pay attention to how we're handling that pasteurized colostrum. I've been to herds where they just assume that if it went through the pasteurizer, it could sit out for a while. That's not necessarily the case. We need to still get that fed immediately or get it frozen or cooled down quickly. So this is a slide. The little thing you see on the left, we call a hobo. It's a Bluetooth temperature device. So one of the things I'll do sometimes is drop this in the colostrum that's being cooled in the refrigerator, tie a string or piece of fishing line on one end, and I can actually figure out how much time it's taking to get cooled. So these lines on the bottom are hours. So remember I said I want it less than 60 degrees in about 30 minutes. Here, this is a commercial walk-in refrigerator on a large dairy out west. Took 4 hours on this dairy with what I would consider a very good refrigerator to get the temperature less than 60 degrees. So just because you're throwing it in the refrigerator and shutting the door and assuming it's cooling, that's not always the case. Here are examples of things I like. So this was a dairy where they just had a big bucket with ice water in it. You know, ice water is probably the quickest way to to cool it down. If you put a beer in a cooler of ice or a beer in a cooler of ice and water, it's going to get cool much quicker in ice water. So what they were doing here is they were testing the colostrum with the bricks. Blue gloves were going on everything that tested as good quality, and clear gloves were going on everything over here with the red nipples that tested poor quality. They actually do have gloves on them. You just can't see them. Same thing over here. They had a smaller cooler. They were putting their colostrum in here, and they were marking good versus marginal or poor quality colostrum. So ice is really key if you're going to try to cool this down quickly. To me, the best way to make ice, if you don't have a ice machine, some large dairies will have ice machines, but you can freeze water in rectal sleeves pretty easily and then break it up with a hammer, and you can have ice really, really quickly on dairies. So keep that in mind. This is another dairy that I was on a couple months ago. They actually had an old chiller that they were putting colostrum in perfect gutter bags, and they were getting it cooled down to about 45 degrees instantly. So these little orange things are floats, so the colostrum wouldn't sink. And they were basically just continuously managing this. And as soon as the calf hit the ground, they would pull a bag out and feed it. So everything was getting cooled really, really quickly. And then, of course, they would warm it back up before feeding. There are commercially available machines or equipment that will warm up colostrum. There are colostrum warmers. You can make your own. This picture on the right, out of a 50-quart cooler and a sous vide immersion cooker. Typically, you want the temperature to be no more than 125 to 130 Fahrenheit for warming colostrum. So, you can still put it in a bucket of hot water. You do not want to use the microwave. If you can't hold your finger in that water, it may be too hot. We can start to actually denature proteins and things in colostrum if we get the water too hot. So many of you were taught years ago that if you were collecting blood from calves for total protein, you wanted that number to be about 5.5. Well, those standards have gone up. There's a lot of new data now that indicate we have less disease, we have less pneumonia, we have less diarrhea if we can achieve higher or better passive transfer standards. So, we can go through this if people have questions, but generally we want most of our calves to be above 5.8, and above 6.2 is even better. The last thing I want to say about colostrum, and then we'll stop and answer some questions, is post day one colostrum use. And this is getting a lot of attention in the published literature now, both as a treatment for disease as well as a prevention of scours. A lot of research shows that if we're able to, whether it's add colostrum replacer powder to the milk, or if we're able to capture our transition cow milk, so day 2, day 3 milk, or day 2, day 3 colostrum, and somehow incorporate feeding that as their whole meal or mixing that with their milk if you don't have enough, there's a lot of benefit to doing that. It is not the easiest thing to manage on some dairies, to actually, how do I collect that? Where am I going to store that? How am I going to mix it back in? But I think there's going to be a lot of benefit to at least thinking about that moving forward, post day one use of colostrum. We need more research to figure out, how do I manage this? What's the minimum amount I can get away with? How long do I need to feed this for? Is it just the first 10 days? Is it longer than that? 7 days? But just something to think about for now. Is there any way I could see myself incorporating post day one use of colostrum in the young calves? So with that, I'm going to pause and ask Sue if there's been any questions in the chat so far about colostrum before we move on to nutrition.
There has been several, actually, so I'll just get started here. What are your thoughts on colostrum replacement?
So I think every dairy should have some colostrum replacer. I think there are certainly times where we need to use it. That may be, where I live in the fall, for reasons we don't fully understand, we have problems with colostrum volume. We may not have enough. I need to lean on colostrum replacer. I may go through a time where I'm having troubles with my employees and I have dirty colostrum and I need to lean on replacer. What I would say is I would probably never say that colostrum replacer is going to be what I go to long term. I always think I'm probably going to do a better job with maternal colostrum. And also a good quality colostrum replacer is expensive. It's 50, $60 a calf. So I'm in favor of using colostrum replacers. I'm not a big fan of mixing colostrum replacer with colostrum. What I would rather see you do is feed colostrum to some calves, and then when I run out, I'm going to feed colostrum replacer to others. So yes, we do use colostrum replacers. I would also, this is not the time for this, but I would say put some thought into the replacer you're using. One is not just as good as the other. Some of these products work much better than others. You may say, well, this one's very expensive. I don't want to use it. It likely works much better than some of the cheaper ones. So yes, I'm in favor of them, but I'm probably never going to say this is exclusively my colostrum management program, if that makes sense.
What about feeding through a tube feeder versus a nipple? Should we be doing one or the other?
So I'm actually a proponent of tube feeding because they've shown that only about 50% of calves are going to drink adequate volumes. If we think we need to get at least 3 liters and preferably 4 liters, which is a gallon's 3.8 liters, into these calves pretty quickly, if you try to feed them with a nipple and a bottle voluntarily, probably only about 50 or 60%, even if you're pretty patient, over 30 minutes are actually going to drink that much. Trying to feed a newborn calf with a bottle, not everybody's cut out for that. That's a difficult job. So I think if we can use an esophageal feeder and our employees are trained how to do it, it's a good way just to get it done. I certainly, if you're a proponent of bottle feeding and you're getting it done and you're tube feeding whatever's left, I don't have a problem with that. I don't know that, from a success standpoint, there's a benefit to one versus the other. Most studies would say they're going to work about the same, but I typically will see better results on dairies using esophageal feeders just because we get it done more consistently than we do with a bottle.
I think this question we might have a little better answer at the end of the talk, but just to bring it up now, if we fail to give that colostrum within the appropriate time frame, how does that impact us in the long run?
So that, I used to teach vet students that you don't die from failure of passive transfer, but it is a major risk factor for disease. If I forgot to give that calf colostrum, if it's up to a day of age, I can still go ahead and give it colostrum. It will get some of the benefit, perhaps not what I wanted, but if it's much more than 24, 30 hours, it's probably not going to absorb that colostrum, but I can still raise that calf. Realize that calf is going to be more susceptible to disease. So maybe that's a calf that I'm going to put in one of my cleaner areas, maybe isolate the calf, but certainly it's a calf I'm going to keep a close eye on. If it spikes a fever, if it wants to go off milk, I'm going to be really quick to get it on electrolytes or treat it. So certainly if I say 30% of calves on surveys are failure of passive transfer, we don't have 30% of dairy calves that are dying. So not all of these calves die. It's just going to be a calf that is going to be at increased risk for disease. So not much we can do for it once it's over a day of age, but making sure that we get it on milk right away, because it's certainly behind on nutrition if it's a day old and missed colostrum. Making sure we get milk in it and just watch that calf closely is probably the best thing.
And last one for right now, how do you tell the good from the bad colostrum replacers?
Talk to your veterinarian. Most of the good ones will have some research behind them. Some of these are made from colostrum. So the companies will actually buy colostrum from dairies and they'll spray dry it and turn it into a powder. And some products are made from plasma, where they actually go to a slaughterhouse and buy blood harvested plasma. Probably research would suggest that the colostrum-based colostrum replacers are a little bit better. But typically what we see is big differences with efficiency of absorption, meaning I can have 200 grams of IgG of one product and I feed it and the calf will absorb 40%, but another product that may only absorb 10%. So just saying they have 150 or 160 grams of IgG isn't always good enough. I would ask the salesman that's trying to sell it to you or your vet, can I see some research with your product? And most of the better products will have some research to support their use.
And I'll just add, in general, if there's an ingredient list on your package, it's not whole colostrum. Your whole colostrum products are just colostrum. They've been freeze dried and packaged and ready to use. So that's the last question for this section if you want to move on.
Sure. So the second half of this presentation, I want to focus on nutrition, and there's a lot of research now that shows higher planes of nutrition, trying to get away from 2 quarts in the morning and 2 quarts in the afternoon, which we've been doing for years in the dairy industry, really has multiple benefits. One, it's going to reduce disease. We know calves on higher planes of nutrition have less disease. And the other thing is they're going to be more effective cows once they enter the dairy herd. Okay. So here's a study that was done by Terry Olivet, who's at Wisconsin now, but this study was done at Cornell. I'm not going to spend too long on this, but this was a study where they had calves that were on what I would call a conventional calf nutrition program. They got 2 quarts in the morning, they got 2 quarts in the afternoon. Then they had another group of calves that were on an accelerated nutrition program. In all these calves, they got infected with cryptosporidia, so they induced cryptosporidial diarrhea. And what they found was the calves that were on higher planes of nutrition, they still got diarrhea, but they got over the scours much quicker than the other group. Okay, so what they noticed in higher plane of nutrition was the calves that were getting more milk, they maintained hydration, they didn't get dehydrated, they had faster resolution of diarrhea, and they grew a lot faster through that scours challenge than did the other calves. This was a similar study that was done with a Salmonella typhimurium model in Texas. This was done by Mike Ballou, and this was similar to the other study. They had conventional calves. They had a higher plane of nutrition. Instead of crypto, they challenged them with Salmonella. Not only did those calves on a higher plane of nutrition handle the Salmonella challenge better, but in this study, they actually characterized the immune response, and they found that those calves on larger volumes of milk had a much more stronger, if you will, or more robust immune response to the Salmonella challenge as compared to those calves that were just on 4 quarts of milk a day. We know there are strong links, strong connections between the immune system and nutrition. And when we can feed those calves higher volumes of milk, you're going to have animals that are more resistant. They're more able to fight off infection. So this was an interesting study. This was just published earlier this year. This is from Germany. So this is South Germany, Bavaria, large dairy industry there. This was done by the Bavarian Animal Health Service, which would be like our government, our USDA here. What they did in this study is they looked at risk factors for herds that reported frequent diarrhea in their calves versus herds where they didn't treat more than 10% of calves for diarrhea in the preceding year. So high-risk herds versus herds that didn't have much diarrhea. And they did a very comprehensive survey. They sent veterinarians that were employed by the government out to these farms to really see what the differences were between herds that were having problems and herds that were not. Okay, so if you look at this slide, some of the things here are pretty predictable. Farms that had calving pens that were cleaned after every calving, they were less likely to get diarrhea. That makes sense. Okay. If they fed 3 liters or more of colostrum at the first feeding, they were less likely to have diarrhea. Well, we've talked about that. If they gave a second feeding of colostrum, they were less likely. But the most significant thing they saw in this study that prevented diarrhea was ad lib feeding of milk during the first week of life. Again, if they're in better shape nutritionally before they get scours, they'll sail right through it most of the time. The other thing we know now about milk is the more milk we feed, the higher average daily gain we can get in that first period of life. Typically, the more milk we're going to get when they enter the lactating herd. There's been a lot of studies about this. The differences have ranged from somewhere about 1,000 pounds to even 3,000 pounds more milk from heifers just in that heifer lactation. not over their lifetime, just in one lactation. And we're not able to really make this up just by, some dairies will say, well, milk's expensive. I'm going to feed them cheaply for the first 8 weeks, but then I'm going to make up for it. We seem to lose that milk. There's something that happens in that first 8 weeks that we can't come back and make up for later just by trying to have compensatory growth later on. That nutrient intake in the pre-weaning period has a direct impact on mammary gland development and future production. So this is from a meta-analysis paper, which takes a whole bunch of other studies and puts it together. So you can see there's like 13 different studies here. And if you look, this is in kilograms on the left, so I put in pounds. These are the difference in milk production they've seen, the increase in milk production associated with higher milk feeding, okay? And you're going to ask, well, what is higher milk feeding? And I don't know that I have a minimum amount that I think you should be doing. To me, if you're feeding 4 quarts and I can get you to go to 6, I think that's a win for me. But certainly, eventually getting calves to 8 liters or 8 quarts a day, somewhere around there, would be a good goal. For every quarter-pound increase in average daily gain we get in the first 8 weeks of life, we can see milk production increase by as much as sometimes 400 to about 500-600 pounds in that first lactation, depending on what study we look at. So, if you're right now at a 1.5 average daily gain between birth and weaning, if I can get you to 1.75, you're going to see 400, 500, 600 pound increase in milk production in that first lactation. We're going to talk about goals for average daily gain in a minute, but typically I would love to see you in the 1.7 to 1.8 pounds per day range. With that, I'm going to talk about some goals, but let me stop there one more time and see if there's any questions about milk feeding and nutrition.
Got a couple here, Geof. One actually relates back specifically to, you had a slide looking at total proteins and Brix readings and stuff. What's the what's the correlation between IgG and total proteins using the refractometer? How confident can we feel in those numbers?
So very confident, except in dehydrated calves. Okay, so we've known for a long time that total protein was a good way to approximate the level of antibody in the blood. It's a very linear relationship. As total protein values go up, antibody levels also go up. The problem is, if I have a dehydrated calf, I'll also have elevated total protein. So certainly if you have a sick calf with diarrhea, that's probably not the one to check total protein on. But if you're getting numbers in the 5, 6, low 7 range consistently, that's probably real. On some of these calf ranches, particularly during this time of year, if you have calves that are 8.9 or 9.2, you probably have a lot of dehydration in there. Those numbers are probably artificial. So with the exception of dehydration, there's a very good correlation between antibody levels and total protein. And if you're anywhere in the 6s, that is great. If you're less than 5.5, that's not good at all. Typically, your total protein will be about 4.5 if they have had no colostrum at all. So between 4.5 and 5, we typically say is complete failure of passage transfer, and in that 5 to 5.5 or 6 ranges, they got some, but not enough, if that makes sense.
What about average daily gains on jerseys? Is that 1.7 to 1.8 just for Holsteins, or?
Yeah, if I can get jerseys in that 1.4 to 1.5 range, we don't have quite as much data on that. And honestly, I don't do a lot of jersey work here because we're pretty much a fluid milk market on the East Coast. But in the jerseys that I do interact with, typically 1.5, we can get 1.7 on aggressive nutrition programs. But I would hope to be at least in that 1.5 level.
What about feeding pasteurized waste milk? What do you think about that?
I have no problem with that. Again, I want consistency is really important, which we're going to get ready to talk about. So what I don't want is I'm going to feed pasteurized waste milk today because I have it, but tomorrow I don't, and they go back to milk replacer. If you want to start with milk replacer just to make sure they're getting a very consistent feed and then eventually switch to pasteurized milk at some point, that's fine. I like pasteurized milk. I just want to make sure that I have a consistent product that I can offer to that calf every day.
What about the hot, cold weather differences? Here in the Mid-Atlantic, we've got, especially this time of year, we've got higher refusal rates with this hot weather. Cold's not as bad, but.
Yep. That's a problem everywhere. Certainly, if the easiest thing for me to say, which is not always easy to do, is feed 3 times a day. If you can feed 2 quarts 3 times a day versus 3 quarts twice a day, you're going to have less refusal. On dairies where a third feeding is not possible, I would say, push that afternoon feeding as late as possible. If you can push it till 7:30 at night when it cools off, that's great. If you're feeding, the other thing some dairies will do is they may go ahead and feed 4 quarts in the morning and just 2 quarts in the afternoon instead of 3 and 3. You can try to split up the volumes to take advantage of when those calves are hungrier. So there's not a magic answer. Certainly, if you're pushing a lot of milk in those calves, you'll have times of the year where they're not as willing to drink the afternoon feeding when it's really hot. But there are things that we can do, as well as, a whole nother webinar could be how to manage heat stress in calves. There are things we can do to manage heat stress that will make that a little more palatable as well.
Right. And as a follow-up, I think that kind of alludes to it is would shifting to a late afternoon and overnight feed schedule help that?
Probably some, yes.
The other challenge is we feed more milk, they eat less grain. How do we handle that transition? Because we need to make sure grain intake's good.
So typically what I like is not at least, but 2 step downs. Okay. And I want them to last 5 to 7 days each. So if you've been feeding, for example, 3 quarts 3 times a day, I would like to see one period where I'm going to decrease that to 3 quarts 2 times a day for 5 to 7 days. And then a second step down where maybe I just feed 1 bottle in the morning for another 5 to 7 days. If you were feeding 4 gallons, or not 4 gallons, but 4 quarts and 4 quarts, you may go to 4 quarts and 2 quarts and then just 1 bottle. But we need to make sure we step them down. I don't want to step them down too early. I see some dairies that by week 4, they're stepping them back down already. And that's really your prime time for good weight gain. But maybe week 6, we start a step down for a week and then another step down and then completely off milk by week 8, or you can even push that back. But you can feed a lot of milk as long as you will step them down. And you can really step them down twice in 10 days if you need to compact that a little bit.
Last one we've got for this section: when feeding whole milk, is the composition of Holstein or Jersey milk more optimal?
This is going to be probably a stupid answer, but Holstein milk is pretty optimal for Holstein calves, and Jersey milk is pretty optimal for Jersey calves. I would not have any trouble feeding Jersey milk to Holstein calves. They could be okay with the extra fat. Jersey calves certainly need a little bit of extra fat. If you have high producing Holsteins that have, marginal butter fat, it may not be enough to support Jerseys. If you have a calf ranch and you're feeding a lot of Jerseys and buying Holstein milk, we probably would need to look at a balancer. But there are some differences, and in general, the Jersey calf needs the Jersey milk with a little bit higher fat.
Last question. What's your opinion about feeding calves with hospital milk without pasteurization? Is there a concern in antibiotic resistance?
Probably. I'm a little bit more concerned with disease than I am with antibiotic resistance. I think there's a big concern about, just having high bacteria in there, potentially transmitting Johne's, potentially transmitting Salmonella, potentially transmitting Myco. There's certainly a big disease risk. I used to talk to students about, would you take your kid to a different daycare every day and expect them never to get sick? Of course you wouldn't. antimicrobial resistance, there is some work on that, and you can see increases in resistant bacteria in the gut. What we don't know is how long they last. Okay. Are they going to go away after a while? We haven't really followed them out to see, once she's 12-week-old or once she's a 6-month-old, does she still have more antimicrobial resistance? It's a concern. I don't know if it's to me, as big of a concern as increasing the risk of disease with unpasteurized waste milk. If I'm a small dairy, everything's okay. You can get away with not pasteurizing it. Once you're in a larger dairy and have more disease pressure, if you're going to commit to feeding waste milk long term, you really ought to think about a pasteurizer.
And to add to that, if you want to look through Journal of Dairy Science, there are actually publications from the last 5 to 7 years on the antibiotic resistance of pasteurized milk. So there are publications out there that look at resistance using pasteurized milk.
There's a guy at University of California, Davis, named Richard Pereira, Perriera. He's Brazilian. He's done a lot of work and has published a lot on waste milk leading to antimicrobial resistance. But again, how long did it last, I guess, is the question. How significant of a long-term issue would it be?
Another one that just came through. What's your opinion of adding milk replacer to Holstein milk? 4% fat or lower.
I think if we're using a balancer, that's fine. We don't really need, typically with Holstein, you shouldn't need a lot of extra fat. You may benefit from some extra protein, a 25-10, 25-8, something like that. Just using milk replacer, I don't know if we necessarily need to do that. The other thing I would say is make sure you're monitoring your total solids. I am not a fan of really aggressive total solids. We used to say 16, 17, 18%. I'm more a 14 and a half kind of guy on total solids. So I avoid putting a whole lot of extra stuff. It doesn't mean that we can't use, probiotics or things like that in the milk, but I avoid putting a lot of extra stuff in waste milk. But certainly if you're feeding waste milk and you say, my total solids is 10, I think I need a balancer because it's watered down, I'm okay with that.
Okay, that's it for now.
So consistency, and this kind of relates to the last question as well. What I really want is for what that calf drinks every day to be a consistent product. What you see on some dairies is we're feeding waste milk, but our supply goes up and down depending on what we have or depending on what we can buy on calf ranches. And we use milk replacer powder like we asked in the last question to make up the difference. It's not that we can't do that, but we typically will see more problems when we do that. I want the milk that calf drinks to be very consistent every day. If you look at most large dairies, most large calf ranches, it's almost like a commercial human kitchen. These are very regulated. When the milk cart goes out, 29 minutes later, it's back. It's a very regulated process. So, every feeding, every day, every calf, very, very consistent, I think is important. Best practices. Consider feeding colostrum and a transition milk for the first few days. We talked about that. It's very easy for me to say. I get it. It's harder to manage, but just something I think at this point to start thinking about, how would I manage that? Good quality milk replacer, at least 24% total protein. If you're a very large operation, think about investing in a computerized milk mixing system, making sure we're weighing powder, not just saying 8 scoops in this much water, because, there's a lot. Sue's scoop and my scoop may be very different. Okay. But if we weigh 9 kilograms of powder out, it's going to be the same, whether it's her or I doing it. Increase milk feeding early. I have a lot of people tell me, well, I'll feed more milk, but I can't do that till they get through scours. Okay. What I tell them is, if I go from 4 quarts a day to 6 or 8 quarts a day, I'm going to have a lot more manure. And if you've changed the diaper, you realize milk is not very solid when it comes out the other end. It's pretty loose. So a lot of times I think there's perception of diarrhea, but it's not really diarrhea. sometimes we have contaminated milk because it's waste milk with high bacteria and they are getting sick, but we need to go back and work on the front end. So we should be able, at least by 5 days of age, to get 6 quarts in these calves, not after they are done with scour. So again, I'm increasing milk early so that we can get them in good body condition before they go through scours, not just after. We want to have access to good quality hot water for cleaning and sanitation of buckets and bottles, and really pay attention to consistency. Limit the number of cooks in the kitchen. You know, on a big dairy, I try to have one person or maybe one person morning and night in charge of mixing the milk, not necessarily whoever gets there first. That's an important job. Again, relating back to consistency. I want that to be done the same every day. We talked about stepping down, 2 step downs that last 5 to 7 days. And then lastly, I would encourage you to weigh calves. You know, that's kind of like checking total proteins. I don't necessarily have to do every calf, but I at least want to do it sometimes. I want to have a birth weight, and then I want to weigh that calf at weaning, or at least when I move them out of the hutch or the pen. And that's probably the best way we can evaluate our milk feeding program. I had a producer tell me a few weeks ago that anybody that tells me to weigh calves has obviously never done it. I get that it's not fun. We don't have to weigh every calves, but if we can weigh sporadically and figure out what is that average daily gain, that's really going to help me or anyone else evaluate your milk feeding program. Trailer weights, you know, perhaps are better than nothing to get a group weight, but they don't offer me the information I want. What I really want to know is what's the impact that disease is having on your program. So if you just tell me my average is 1.5, I don't know if there's a bunch of calves that are 2s and a bunch of calves that are 1s because they all got scours. I really want some individual weights so I can look at the variation. Okay. And as we're getting towards the end now, here's kind of some goals. Some of these are from Dairy Calf and Heifer Association gold standards. Some of them, like the average daily gain, are kind of my opinion. But this is, you know, if you're more than 6% mortality, there's certainly room for improvement. Percent of calves with disease, Brick's reading on colostrum, an average daily gain. Again, I'd love to see you at that 1.5 to 1.8 range. That's good. Certainly, there's opportunities for better than that. I was on a dairy last week where they were about 2.3, where calves were drinking basically as much milk as they wanted right from day one. That's about as high as it goes. But if you're 1.4, 1.3, 1.2, you know, nutrition certainly is associated with some of your disease. Those calves are hungry. They're in a negative energy balance. There's opportunities for improvement there. So conclusions, calves are an expense, but really are an important and integral part of your future. The key is not only survival, but quality. And really, management is one of the things that we need to be focused on. Day one calf care, colostrum management, and making sure that we have them on a good nutrition program. Prioritizing, you know, the calf program is going to make sure that we have healthy heifers that are very productive when they enter your herd. And I would say calf wellness is really where the difference begins for your success on the dairy. And with that, you'll notice my email is at the bottom here. If you have any questions that you don't get to ask now, or certainly if you're watching this later as a recorded version and you have questions that you weren't able to ask, don't hesitate to send me an email. And with that, I'm happy to answer any other questions that we might have.
We've got another one that came through, Dr. Smith. What about keeping the replacer of milk at the same temperature? The struggle from the first calf to the last calf fed.
Yeah, you know, and there's always going to be some probably drop or increase depending on what the climate is outside. You know, if I can keep it in the temperature range, you know, I certainly don't want 60-degree milk being fed. It may be that if you're in Wisconsin and it's really cold, we just have to take more trips and take fewer bottles out at a time. You know, I think you could take it out 110, 115. That's probably as high as I would push it if it's going to drop in temperature some. but I don't have a magic answer to how do we avoid that. There's a range is acceptable, but certainly there are issues with both hot and cold milk that will increase problems.
I have a couple suggestions on that too. We, in the colder areas, we generally find a way to insulate that tank that you're feeding with, or the unit that's carrying the bottles. The other thing is, especially in cold, and depending upon the time between feedings, feed those young calves first. Make sure they get the most consistent temperature. They need it between 100 and 105 degrees. The older calves can tolerate a little bit more variability. So those are my practical suggestions from on the farm. The other question that came through, Dr. Smith, colostrum's a key. What nutritional strategies do you recommend in the transition period to increase colostrum quality, and that what can actually be truly reflected in the colostrum?
That's a good question, and we don't, unfortunately, have a lot of research on that. Most of that has come from the beef industry, where we know, starving cows or cows that are in poor body condition will have less colostrum volume, and the quality of that colostrum will be less. We don't know a lot about. We certainly know heat stress during the dry period is associated with poor colostrum quality. That you're going to have those blood vessels constrict from heat stress, what we call vasoconstriction, and you won't deliver as much blood to the udder. But nutritionally, I'm not sure we understand a lot about it. I will say herds that are very aggressive with anionic salts, perhaps that are over acidified, if your urine pHs are less than 5.5, sometimes we have issues with colostrum volume. But as long as we have good energy levels, we usually have good colostrum quality. I don't know if we understand more specifically if there's certain micronutrients and whatnot that are associated with good quality colostrum, but certainly from an energy standpoint, if we have appropriate body conditions at calving and we're not overly acidified, we should have good quality colostrum.
We can also influence that by vaccination strategies too. So something else to think about in the future. Absolutely. Anybody have any other questions? Kind of slowed down a little bit here. Only other one that popped up is bottle feeding versus bucket feeding. What do you think?
This is kind of like with colostrum. You'll hear strong proponents on each side. I really like bottles. I really like buckets. I have dairies that do a good job with either. If you were to say I'm starting a calf dairy farm or calf ranch tomorrow, what should I use? I would probably tell you bottles. To me, people are more clean with bottles because they go out, pick them up, and wash them. Bottle feeding is probably a little bit going. Some of them will stick their whole nose in it. So I'm certainly not opposed to bucket feeding, but if you ask me my preference, it would be bottles.
How about how long can you store colostrum in the fridge when stored in a clean bucket with lid? My question is, are you sure it's clean?
Yeah, and I typically would say if you don't think you're going to feed it within 48 hours, I'd go ahead and freeze it. You can use potassium sorbate, which will slow bacterial growth. So there are some herds that will do that if they think it's going to be in there 3, 4, 5 days. But certainly we should not be feeding, week-old refrigerated colostrum.
Any more questions? We're going to wrap it up here. Okay. If you're filling a pasteurizer with hospital milk, how do you manage the bacteria count as it sits? Milking could be X hours long. Is it recommended you cool that off too? Yes.
Yep. So remember that when you pasteurize, you're going to basically decrease by 2 to 4 log the number of bacteria that are there, but you're not, you put milk in your refrigerator, it's not good forever. It's going to eventually go bad. We're decreasing the bacterial count. So if I pasteurize it and then it sits in the sun for 12 hours before the evening feeding, it may be back up higher than what it started. So again, with both colostrum and milk, if we pasteurize it, we still need to get it cooled down until we're going to feed it, if that's going to be more than a few minutes.
All right, that looks like it's it. If anybody's interested in more information, Geoff's email is there, and mine will be posted too. Zoetis has made calf wellness a priority, and if you'd like more information or some help troubleshooting some of these areas or developing protocols, don't hesitate to get a hold of any of us. Calf wellness is where the difference begins, and we're excited about making some changes. Thanks. Everybody, have a good day.